What is the difference between a psychiatrist and a psychologist? And then we'll get to know a little bit about your background so the audience can just, know your credentials and know you're just not somebody who's an actress and looking to try to pass off a psychologist. So first of all, psychiatrist, psychologist. First of all, does this irk you in any way? Or a little bit?
Irk me as far as when people ask me what the difference is. Sometimes, yeah, it definitely does. So like you said, in movies and TV shows, the two are typically used interchangeably. So the major difference is a psychiatrist is a medical doctor. So they went to medical school and they prescribe medication and typically do not do any type of therapy, nor do they have the training to do that in present day psychiatry programs. And psychologist is someone who has a doctorate degree, so a PhD, an EDD, a PsyD in psychology, in clinical psychology. So we can do testing, we can do psychological testing, one of the major differences. So we're both, called doctors. So a lot of people mistake the two.
So, all right. Now, I know I can probably just Google this later, but you're right here. EDD.
Yeah.
What does that mean?
It is a doctorate in education.
Okay. And do you quickly correct people if they call you a psychiatrist?
Yes.
Okay.
Very much.
And it's why is that?
Why do I correct people when they say, are you a psychiatrist?
Well, I mean, I guess, you would want to correct anybody who, if somebody calls me a professor, it's like, no, I'm just a teacher. So, but in your case,
It depends on the audience.
Okay.
Yeah, on how forthcoming and forthright I am about it. But usually it's more so for the medication because people often think I can prescribe medication and I can't, nor do I want to.
Right. So both are good, but psychologists can do a lot more good, you feel, or are capable of doing a lot more for a vast majority as opposed to psychiatrists. And that's mostly within recent years, because it wasn't always like that?
So historically, psychiatrists would do a version of therapy and spend like an hour, with their patients. But because of insurance limitations, they usually only have an hour for the evaluation and then 15-minute med management. Oftentimes, they don't even know who their patients are. Mm-hmm. I've had my patients complain about that. Where, psychologists, we spend an hour each week. We really get to know people. And I think our job is more difficult to some degree because we have to help people change their thinking and change their behaviors. We do collaborate and work with psychiatrists. So I wouldn't say that one is better than the other. They can complement each other.
Okay.